There are many sports injuries that we see in physical therapy. Some commonly are your knees. The big one is your ACL and meniscus tears.
A pitcher would have a rotator cuff injury. Runners will have knee and hip injuries. Football players would also have knee injuries, ACLs, MCLs.
Sports injuries occur traumatically or non-traumatically. Traumatic meaning that somebody actually hit into them or tackled them the wrong way, whereas non-traumatic would be somewhere where there was no contact and the injury was caused by something like a muscle imbalance and some type of dysfunction that may have been arising. There's a difference between sports physical therapy and traditional classic physical therapy.
With sports PT, we make everything sports specific.
Athletes need to be treated as athletes. As sports physical therapists, we understand the demands of the game. We understand the rigors of their sport and what it's going to take to get them back on the field as quickly and safely as possible.
Without physical therapy and the athlete's rehabilitation, it's going to take them a lot longer to get back, and there's also a greater chance of re-injury.
Future injuries can be avoided by making sure that the athlete is ready to return to sport. What we do is we have certain protocols that we use to make sure that the person is functional enough, strong enough, and mobile enough to return to their sport.
We do treat athletes after they're injured, but we also treat athletes before they're injured to prevent injuries from happening in the first place.
An athlete can avoid injury and prevent injury by seeking out a physical therapist to do musculoskeletal evaluations and assessments of movement to predict any risk of injury.
With sports PT, we're preparing you for return to activity. Not 90%, but 100%. So we want you, when you leave the facility, to be completely ready to get back onto the playing field.